Welcome to Bodyholic, Dr. Michael Lavie. How are you?
Thank you. I'm great. I'm great.
I'm so excited to have you here. I think very highly of the way you handle yourself, the way you express your opinions, and in general, the way you bring information to the public. So it was crucial for me to get you onto Bodyholic, and so I'm so grateful.
Thank you so much.
We are going to stick to the theme of season 4 of Bodyholic, where I celebrated my 40th by getting onto season 4, by opening season 4. And so I've been obsessing over perimenopause, menopause, and such. But also, the truth of the matter is, I do get a lot of inquiries and questions regarding this and working out during perimenopause and menopause, et cetera, et cetera. So, from a medical perspective, what
Mhm.
are the earliest biological changes of perimenopause before cycle changes even appear? And what are they? And why do so many women, and this is the thing that really uh, shows up in the questions towards me, is why do so many women feel off? That's what they
Okay.
describe. They describe feeling off in the years before doctors actually officially label it menopause.
Welcome to Bodyholic with D. We don't do fads here. We give you the facts that move your body and health forward. Wait up, hold up. I'm not a doctor. The information in this podcast is for informational purposes only and not medical advice. So kick back and enjoy the show.
So that's a great question because this is really what happens. The thing is that when we want to diagnose menopause, it's quite easy. It's when a woman stops getting her periods, and this was the always the definition for many years. And the thing and the most intriguing thing about perimenopause is that we see sometimes normal menstrual periods and normal hormones, but then still that's the time frame that's several years of mood changes and hormonal changes that do proceed, and that's the most confusing, both for women and both for doctors, and the most confusing period of time, because we don't know really what to treat and what to ask. And the woman comes, whether it's to the obstetrician or the gynecologist or the endocrinologist or just a family doctor, and doesn't really know what to ask. But during the last few years, we know of more and more research about perimenopause, and we know that the first thing that changes is that there's a disturbance in the hormones. Now, the brain a lot of the times interprets the problems in the fluctuations as a problem. The brain knows how to handle low hormones. It knows how to handle high hormones. It doesn't really know how to handle the fluctuations. It changes, and those changes come with anxiety, with problems of sleeping, with tiredness, fatigue, and all those things that come years before the menstrual period itself changes.
So these are all symptoms of the fluctuations.
Yes.
So I have to say that really what I'm seeing, now that I'm in my 40s and I'm surrounded by women who are over 40. What I'm getting really is this wave of women now in at this point in my life of women who are really describing deep frustration, almost desperation regarding their day-to-day life. And so I'm asking you on a really practical level, is there something that you can actually say that you almost prescribe, maybe lifestyle wise, that you know this works and this will benefit the women and maybe move them away from their very frustrated period of time? Or is this the kind of situation where you're like, you know what, it's a matter of time, so just wait it out?
So that's a complex question, and I would start by the first thing we need to do is diagnose it and put a label on it. And the years of 40 we talked about it slightly before we started are also the years of having small kids and the stressful jobs and the stressful career, and sometimes even right now in Israel with all that's happening. And it's always hard to pinpoint what's the problem. Why am I tired? Why am I anxious? Why is it because of work? Is it because of perimenopause? Is it because so one of the things is to try and pinpoint the problem. If you don't get a lot of sleep, if you eat improperly, if you have a very stressful job, that could be one of the things to change. But if everything is perfect and you sleep well and everything's well and you're not stressed at work, then maybe that's perimenopause. If you feel crazy, even though life is pretty good, that's maybe perimenopause. And yes, there are things to do. One of the things is, and we know it's a healthy diet, um, strict body work and physical exercise, whether it's anaerobic or aerobic exercise. We can talk about it later, but doing physical exercise helps. And also, if we target that phase of perimenopause, hormonal treatment can really help. I see it a lot. I mean, people, women who work out with me and feel very tired, and we talk about it and we say, okay, maybe perhaps it's the perimenopause, and I put them on hormonal treatment. Then eventually they say, oh my God, I mean, my workouts are completely different now. I feel more
Wow.
energized. I feel better. My sex life is better. So if it's not the other related things, it could be. I would definitely think about perimenopause and ask my doctor about it. Could it be perimenopause? Is there something to do? And the answer is yes, there is.
So first we just look at the lifestyle and what's objectively going on in life. And then when you're seeing that, okay, life is just, continuing as it's continuing, maybe even we took actions to reduce the stress, but still there's that fatigue and anxiety symptom. That's where we step in and say, hormonal treatments might actually work.
Yeah, I mean,
And
one of the things to check is also the thyroid and the pre-diabetes or diabetes that happens. But yes, once we've deleted those things and we've seen that they're fine, then yes, perimenopause could be one of the things.
okay, so what happens when we take the blood test and check the thyroid, et cetera? Can you walk me
So
through that?
So um, let's go to the end point. In perimenopause, the most frustrating thing is everything is fine. The labs could be great because first of all, the labs look at just the point of taking. I mean, if you take it Monday morning, so they tell you that the hormones are fine at the point that you took them. We're not checking the hormones during the day and during the changes, and we've talked about it that the fluctuations are the things that make you go crazy. So and since we can't check for fluctuations unless we do it in a research facility, like taking blood tests every hour, and so we won't know. And the majority of women that we see in perimenopause have perfect lab results. Um, so that's one thing to bear in mind. Even for doctors, I mean, that's one of the things we've talked about it for the last few years. Up until a few years, we said, okay, your labs look perfect. You're not in menopause. It's not that. Don't take hormones. Now we know that sometimes, even though labs are perfect, hormones could benefit.
Super interesting. What age would you say? Because from just from my layman's point of view, it seems like 45 is the perimenopause age. But all of a sudden, when I'm really paying attention closely, I'm hearing it from different spectrums of the 40s. But can you maybe shed a little bit of light on
Yeah,
that?
so usually in Israel we say that the age for menopause itself is 51, and but the age goes from 45 to 55. So perimenopause is taking 5 years earlier. I mean, so it's 40 to 50, I would say.
Hmm.
So definitely women at 40, 41, just after finishing childbirth, maybe start feeling those symptoms. And sometimes again it's really hard because you just gave birth 2 years priorly, and now you feel tired. So am I tired because I have a small baby? Am I tired because I'm
Right.
lactating? Or is it something else?
Right. Absolutely. Um, so
By the way, there are signs on ultrasound that we could know of luteal insufficiency, what we call, that's the medical term, because the ovaries, we'll talk about like the job of the ovaries. And one of the things is to make the follicles, one is to make the eggs, and one is to make the hormones. And most of the time, when you're young, it works fine, but then the eggs deplete, and also at the later stage, when you're going into menopause, also the hormones deplete. But that phase of where the eggs deplete when you still hormonal sufficient, that's the phase of perimenopause. So we see that on ultrasound. One of the things we can see is that hormonal looks fine, but you don't really have any eggs or any follicles on your ultrasound. So that's one of the triggering signs. Okay,
mm,
maybe that's perimenopause. Maybe that's the phase that we don't see the production of eggs, and she could be going through perimenopause.
super interesting. All right, I've got to pause this for a moment and just say, and now we've got to get into some personal questions because I have to tell you something crazy. And I feel like I'm going to tell you that it's crazy. I'm going to feel like it's crazy, and you're going to be like, "Oh yeah, that's like what
Okay.
happens." Okay, ready? I finished. I stopped breastfeeding after almost 2 years, just a few weeks ago, which is amazing, amazing. And um, now I never really had a normal period at any point in my life. There may have been a little point after I finished breastfeeding my oldest, and then I started working on my next pregnancy, and I don't know. I can't understand anything from that period of time really because there was hormonal treatments. But now I finished breastfeeding. And again, I'm just reminding everybody I'm 40. Okay. I finished breastfeeding. And for the first time in my entire life, first of all, the fact that I even got my period after breastfeeding, I had to like text my mom. I was like, oh my God, I got my period because that's how rare it is for me. And then 40 days later, I got my period again, which was mind blowing because normally I would be like, I'll have my period again next year. And then 29 days later, I got my period again, which was in, as you can
Mhm.
see, I'm speechless. So for me, that is unbelievable. Now we're talking about the opposite situation, right? We get into the 40s, and you can see in the ultrasound how things are really changing in the ovaries. And then there's me, right? Where it's almost like I just hit puberty.
Yeah. So,
So can we talk about that can we just open
so
up the cards there?
I mean, first of all, of course, it changed from one to another. And one of the things to ask is maybe ask your mom, when did she stop getting her periods, and if her menopause is at 55, and you in your family women get menopause later in life, then yes, you probably could get menopause later. It means, which means that your perimenopause go is later. Maybe you'll be in perimenopause only at 47 or
Hmm.
46. That's one of the things. The other things we know is that during pregnancy and in lactation, when you breastfeed for almost 2 years, then the whole hormonal axis shuts down. We know that breastfeeding is at least a good contraceptive for the few months, and it happens because prolactin, which is the hormone of breastfeeding, shuts down the whole hormonal axis. Now, probably what you did is kind of restarted your whole hormonal axis, and with the changes in lifestyle that you've been doing, probably that's another thing that that makes the system healthy again. So as we talked about nutrition and we talked about physical exercise, so perhaps now you're in a better condition that you've been prior to the pregnancies, and maybe if you've won yourself a few more years until perimenopause or until you get that feeling.
I was diagnosed in my early 30s as having a polycystic ovary structure. I think that's and would that have anything to do with my periods only becoming regular later in life?
So yes, I mean, we know when we talk about polycystic ovary syndrome, that's a metabolic and a fertility syndrome. One of the features is looking looking at the ultrasound, looking at the appearance of polycystic appearance. Now, the polycystic appearance by itself does not mean that you have polycystic ovary syndrome, but it is one of the signs. And we know that since it's a metabolic system, a metabolic syndrome, we see problems in insulin resistance, in women who are overweight and gain weight because of that syndrome. We see high testosterone levels. So, and we see that sometimes when we do when we change the nutrition and we do more physical exercise, we can change that paradigm and get that syndrome to be more regular. So yes, you could change the look of your ovaries by changing your lifestyle, and you could change the function of your ovaries by changing your lifestyle.
But then there's me, and this is really interesting because I didn't change anything in, I want to say, I can honestly tell you that I didn't change anything in 10 years. Okay.
Okay.
Maybe in the last 20 years, probably in my 20s, I had a whole lots of ups and downs, but actually overall, I'm, people think I'm extreme. I think that's ridiculous. I'm just very healthy. So in my choices.
Mhm.
So, that then I wonder, like, because I don't have any of the other signs of the
The
polycystic.
ovaries.
Yeah. So it's interesting to me, like, how does this make sense? Or am I super on, am I an outlier, or is this something that actually is more common?
No, one of the things is that the minority of polycystic ovary syndrome is what we call lean PCOS, meaning women who are fit and who are lean and still have that metabolic problem. So one of the things to diagnose is taking the blood tests and looking at metabolic indices like testosterone and estrogen and insulin resistance. And sometimes even fit and lean women have problems with those hormones. Now, my guess is that you're one of them, and also and by changing your lifestyle is not something that changes the syndrome, and
Mm-hmm.
maybe just getting older and breastfeeding and with the pregnancies that changed something in your hormones that
Mm.
now is kind of changing the regulation of the hormones and gives you more regular periods than before.
Super interesting. Would it have anything to do also, and maybe this is completely me making it up, with the amount of follicles that I used to see in the ultrasounds? Because when I had fertility treatments, especially on the second pregnancy, it was a really long process. So I would regularly see
A lot
and
of follicles.
it really, and it was exceptional. And every time I would actually go through harvesting the eggs, they harvested so many. So does that also have to do with it? Like maybe literally making more room, or am I making that
So
up?
the interesting thing about polycystic ovary syndrome is that it's not a deficiency in eggs. Sometimes opposite. You have a lot of follicles, and the thing is that the regulation is disrupted. At a normal period, what happens is that you begin your menstrual period with a lot of follicles, with a lot of eggs, normal women, and then there's a regulation that just gives out one that ovulates. There's one specific follicle that's the chosen one, and then it disrupts the others from growing, and then that follicle ovulates. Now, something in that regulation goes away or is disrupted in the polycystic ovary syndrome. And there's a lot of, it's like FOMOs, having a lot of choices that you don't know what to choose from. So you have a lot of follicles and nothing gets chosen. So maybe now that you have less follicles because of the age, it's easier to choose from. It's easier to get one follicle.
Wow. Okay. Really, really interesting. There's also something that on a professional level, I'm noticing that I want to bring up, that a lot of really strong, really active women in their 40s also describe that their body just stops responding to training, to nutrition, also to sleep. Sleep is, a really big deal. Once you hit 40, there's a whole down regulation, or actually melatonin just isn't produced as much. What could these women do to actually help themselves if it's not hormonal therapy just yet? And they're doing everything they're supposed to do. They are, top notch with taking care of themselves.
So again, I mean, one of the things that happens with perimenopause is a sleep disturbance, and that sleep disturbance affects your training. When we know that's one of the most important things for recovery and for strength building, and is getting good sleep. And we're not sleeping as good as you should, even though you're going for that 8 hours. But if you keep waking up during those 8 hours, then that's not proper sleep. So one of the things to do is maybe take melatonin or take sleeping pills and get, the good periods of sleep. And one of the things to think about is again, if it's perimenopause, is taking just another is taking a hormonal treatment that could potentially help you sleep better and then help you recover better. One of the things we see is that the DOMS, the muscle fatigue are longer. We see less recovery. You're doing the workout, and usually you could feel that you could exercise the next day, and now you feel that you can't. That's one of the most interesting and the common symptoms of perimenopause.
Okay. So, when I just want to pull out something you just said, you mentioned sleeping pills.
Yeah.
As opposed to, so there would be melatonin, right? That's what everybody talks about. And then there's the hormonal treatment that can actually help. But then when you say sleeping pills, what are we talking about?
That's like the last resort. But if everything else fails and you
Okay.
need proper sleep, then yes, there are chemical agents like Vaban and stuff like that that can help you trigger your sleep during a specific period of time. It's not something I would register for 2 years straight.
Now, there's also the woman who I might fall into this category at times. I think I try to really listen to my body regularly, but I do see a lot of women who train with me kind of ignore all these. They'll tell me all kinds of things that are going on, but then they'll just override it. Would you say this is a risk factor? Or not only that they'll override it and work through whatever it is that they're describing, maybe that fog, that fatigue. What if they medicalize it and also just kind of keep treating it with, I don't know, something for ADHD, something for ADD, like, that kind of medicalization. What is that even a risk? Is that a problem to override it? Can you get into that a little?
I'm not sure that it's a risk, but it does affect your lifestyle and the quality of life. I think that eventually the women you talk about are very know their bodies, and it's always important to listen. listen to the signs, even the small signs. If you feel that something is wrong, then you're probably right. I mean, at least for a specific period of time. If it's a week or two, okay, you can override it. But if it goes on for a few months and so, and you know your body and you feel something is wrong, then again, you're probably right. And that would be the first time I would go to see a physician, whether it's a family doctor or an obstetrician or an endocrinologist. Now, the thing is that, again, since we go like to the regular doctor and you have like 10 minutes per patient and you see a normal patient with normal lab tests, then the easiest thing is saying, okay, you're just hormonal, go home, or you're perfectly fine. But when you take the time to listen that something is wrong, then yes, then we can sometimes see what's wrong, whether it's the sleep, whether it's nutrition, whether it's physical exercise, and whether it's hormonal instability. And then we give the hormonal treatment. I'm not advocating for hormonal treatment, whatever. I mean, that's
Mm-hmm.
not the first thing you just give without the proper listening and kind of pinpointing the problem.
Mm-hmm. Um, so you just mentioned, this is going to take me to one more question.
Like the
And
the, ma- the major take home message is to listen to your gut feeling. If something it feels wrong, then go search the problem. But even if you get a message from one doctor that says, oh, it's nothing, you'll be fine, you won't. Just go check and try another doctor.
it's like you read my mind. That's actually I think that is very important because there really is a lot of information out there. And it could be conflicting information and it could just be confusing information that's just not um, giving the whole picture. Or I do worry about over medicalizing and underdiagnosing. Like I do worry about the um, is the woman, is she really suffering? If she's suffering, can we actually help her? Really listening to the patient. So I do appreciate what you just said because getting a second opinion, getting a third opinion is great. You never have to listen to the first person who's giving you uh, a diagnosis or an underdiagnosis.
And regarding over treating, or so it's again, the most important thing is not telling the woman you should do one, two, three. Is giving options, talking about whether it really bothers you. I mean, if we say it's perimenopause and you're fine, I mean, you're okay with it and nothing really bothers you, doesn't really affect your quality of life, then okay, we don't need to change anything. We don't need to treat something just because it's there. We need to treat only if it bothers your quality of life. But on the other hand, if it bothers you, then yes, there are things to do. So that's another thing to think about.
Yes. Yes. Oh, thank you so much for sharing your wisdom and shedding light on this topic. And if we're lucky, you'll come back and shed light on other topics as well. I
Thank
always
you.
get these questions in specifically regarding women, so I'm excited to record with you again.
Thank you. It's
Thank
always a pleasure.
Thank you so, so much, Dr. Michael Lavie, and we will speak soon.
Speak soon. Bye bye.
Bye.